rehabilitation support, psychological support. This is all huge that helps kids get through cancer.
Absolutely. This is really of utmost importance. And it's not only for the child, for the sibling, for the parent, for the grandparent. We have at the Miami Cancer Institute what we call it the Pediatric Oncology Support Team. When we have a child with cancer, the first thing we do after we get all the information, we sit with family, what's called family conference. In that family conference, you have the doctor, the nurses, you have the social worker to tell the family about all the resources that they can tap into financially. You have the pastoral care to help them with any spiritual thing. You have the pediatric psychologist. You have the palliative care, and you have the doctor. So all these people work together to help the patient, to help the parent, the grandparent, and the sibling. One of the things that happen is when you have a child with cancer in the family, everybody concentrate on that child. And guess what? The other children are the forgotten. And that reflects negatively on them. So we need to put everything in place. Sometimes the family say, this kid is 12-year-old, the 10-year-old sister, who's going to tell her she has cancer? We cannot do that. So there is really a lot of things that help. We call it oncology support services is as important as the drug, as the surgery, as the radiation therapy.
And what I hear you saying a lot of times is the psychological support is huge.
Yes.
Because you're right, the families have to be then treated, the individual has to be treated.
Yes.
Are families really aware? Do they take advantage of that psychological support? Because for some people, I can see where it might be almost too proud.
Yeah.
They don't want to involve too much of the family, and sometimes it's difficult to break down that wall.
Yes, absolutely, and it's cultural too. You know, there is some taboo and stigma when you say psychologists will say, no, I mean, I'm tough, I don't need anything. But yes, you know, everybody get cancer. You went through phases. We call it the shock. No, cannot be, it's not me, or it's not my child. The denial, somebody made a mistake. Then the acceptance, then you go into depression. So we help the family, we help the child to go through this with our specialized pediatric psychology. And every time we tell them, although as you said, this is taboo, we don't want it. Listen, the psychologist is here to help you. Take advantage of them, abuse them. This is what I joke with them basically.